other thing that will feed into future change to the GP contract is the Carr-Hill formula review, which is currently going on. Nick, you wrote about some documents you found on the Department of Health and Social Care website about what the review has been asked to look at, didn't you, just before Christmas? What did they say?
The RCGP says practices in deprived areas have about 14% more patients per fully qualified GP than practices in wealthy areas, and receive 7% less funding on average. And, Carr-Hill is seen as basically the key reason why that inequality exists and persists. And what these documents show is that there's some pretty radical stuff on the table. A report from a working group that fed into the 10-year health plan shows that changes the government could look at include things like keeping a larger share of GP funding outside the main contract and using it to directly incentivise staff participation and support enhanced services in the most challenged areas. GP leaders tend to argue that more funding should go into core practice funding to give practices the flexibility to employ the staff they need to deliver services to their patient populations. But, this sounds like the government could be thinking about moving the other way. In the context of neighbourhood contracts coming out soon as well, there's also an acknowledgement that changing the funding formula will have a major impact, given it's been in place for 2 decades now. A new formula could create winners and losers, big gains and losses in funding for different practices. So the question is, when we start to see neighbourhood contracts emerge in the near future and the government begins to make clear its plans for next year's contract, or maybe the bigger change by the end of this Parliament, what will those changes, what will those things reveal about the future for existing practices, the funding streams they rely on? I think what's clear from this is that really significant change is on the table, is under consideration, and this is all happening at a time when the government and the BMA aren't on good terms. Or worse than that, they're hardly talking. So there's quite a bit of uncertainty for general practice given all of those factors.